or you have not?
I have not, sir.
Please, let's talk.
I have not, sir.
You've not gone through it.
Yes, sir.
Yes. Okay. When is your exam? Has the day been fixed?
No, sir, not yet, sir. Good afternoon, sir.
No, sir.
Good afternoon. Okay. I do the little I can. Bello Oluwaseun, you are using 2 different numbers to join this class. Bello Oluwaseun. Hello, Bello. Are you with us?
I'm with you, sir.
I said you are using 2 different phones or 2 different devices.
Just one, sir. I'm having network issues.
Because you occupy 2 positions here. Okay, let's start. Knowledge, understanding, and skills in social work. This course is just a summary of what social work is all about, telling you the knowledge you need, which we metamorphosize into understanding. When you have knowledge, that knowledge becomes understanding, and that understanding becomes skills. It is progressive. And this will help you in your day-to-day practice as social worker.
Good afternoon. Good afternoon.
Please kindly wait. I think it's network.
Well done. Dollars. Good afternoon.
Please kindly mute your mic. Let's wait for the lecture. I think it's network.
Hello, Oluchi. Who is using C-ISOWN River State Chapter? Is that the state chairman or state coordinator?
Sir, the PRO, sir.
Okay.
Yes,
What
sir.
happened? Was it network problem?
No, I thought it was even your network, sir.
My own network problem?
No, I thought it was even from your
Okay.
own end.
But what about others now? Okay,
That's
fine.
still on the call. That's still
Okay,
available. But I've
no
sent a
problem.
message to the group to remind them for the class.
Okay, no problem.
Yeah,
I
attendance
was
is being
asking
taken, sir.
the material I'm having with me is what you have that was sent to you. Okay. You'll find out as I progress rather. We said social work is a dynamic and demanding profession that requires a variety of skills and qualities. To ensure quality service delivery, social work professionals need to possess a comprehensive understanding and specific skills. Whether these skills are innate or acquired, success in the field requires social workers to continually develop them throughout the lifetime of their career. You know, the skills we're talking about, the knowledge we're talking about, some of them could be innate, some of them could be acquired, but the truth is that you just have to continue to fan the ember rather, to make sure that they continue to glow, that you have to continue to acquire more knowledge, because you can't claim that what you acquire in 1672 is what is still obtainable today. You know, practice is not I just had a class. I had a class this afternoon, and I didn't have issue with network. That's a problem with these online classes. Okay. I said number one is knowledge of skill of social system. Social workers need a deep understanding of social systems, including family, communities, organizations, and societies. This knowledge helps them comprehend the complex interactions and influences that impact individuals and communities. There's no way you can practice in an environment or in a society without having the understanding, the knowledge of the social system. You need to understand what is obtainable where you find yourself or where you found yourself. You need to know the kind of family system that is obtainable there. You can find yourself in a society where they practice matriarchy, which is quite different from where you are coming from, where you practice patriarchy. And so you need to know where they practice matriarchy, definitely they will practice matrilineal, and they also practice matrilocal, meaning that you trace your lineage through your mother, not through your father. You need to understand the kind of cultural system they practice. You need to know everything about that society before you can have a successful, practice in such environment. So you need to have the good knowledge of the social system, the family system, the communities. I was in a place in Cameroon, and we were told that in that place fish is sacred. Nobody go to their stream to kill fish. You must understand their custom, you must understand their value, so you don't go against their belief system, which can also Hello? Hello?
Hi, sir.
I don't know. I'm having network problem. I don't know.
Okay.
Let's see how far we can go. But this is discouraging. I've just explained the knowledge of social system. The next one is human behavior and development, telling us that people behave at differently at different stage or stages of their lives. You know, when you have children, when you have teenagers, when you have adolescents, when you have adults, when you have aged, they behave differently. So you need to saddle yourself with that knowledge of these different developmental stages in human life. So you need to understand how to relate with people of different stage or stages as you practice. Social workers should have knowledge of human behavior and development across the lifespan. This understanding allows them to assess and address the unique needs and challenges of their clients at different stages of life. The next one is social welfare policies and resources. As a social worker, you are expected to, have the understanding of the policies that are in place wherever you are practicing. Ignorance is not an excuse. You may find yourself in any state, you may find yourself outside the shore of Nigeria. So you need to understand what is obtainable in such place. Then you need to know the resources that are available. When you talk about resources, talk about the agencies where you can, refer your clients to. Social workers need to be knowledgeable about social welfare policies and the available community resources. This knowledge enables them to advocate for their clients and connect them with appropriate service and support. When you have this knowledge, you know what is available, where your client can get help or assistance. And this will also help you to know how to advocate for your client, because you know the policy that is being put in place. So you can press that policy to fight for your client. The next one is assessment and intervention skill. You know, when you have problem, when you have clients with different challenges, you need to understand which intervention to adopt. Then the first thing you do when you have a client in your office, after doing the needed clerking, getting the necessary information about them, what we call the personal data. Then the next thing is assessment. Your client, you listen to your client to get the necessary information, because you can't just know anything or everything about your client except your client explain, open up to you. And that is the period, that is the stage of assessment. So assessment and intervention skills. Social workers need strong assessment skills to gather comprehensive information about their client's need, their strength. You need to know their strength. It is possible for two people to have the same issue, but their responses to that issue will be different based on individual strength. The way somebody else will take a news of death is not the same way another person will take it. So you need to know the strength of your client. You understand? So you need to know their needs. You need to know their strengths. You need to know their circumstances. They also require intervention skills to develop and implement effective strategies and intervention to address these needs. You need to know what to do. You need to know the type of intervention skill you are going to adopt for your client. Like I said initially, for the fact that two people have the same issue does not mean that the same intervention skills will work for both of them. So during the assessment, you will know the strength of your client. Then that will determine the intervention skill you are going to adopt, for that case. The next one is communication skill and communication and engagement. You need to know how to communicate well with your clients. You need to understand their level, the level of education of your client. So you must know how to condescend to their level if they are illiterate. You understand? You cannot say because your client is not educated, you are not going to attend to them. You cannot determine who and who will come to you. What they need is your service. What they need is solution to their problems. So you have to know how to condescend to their level to make sure that they get the service which they come to you for. Communication is very, very germane because you have to talk about the giving, the processing, and the response. You receive, you process, then feedback. You listen. We are still going to talk about that. Listening is a skill in social work. You need to know how to listen very well, not that you just interject your clients whenever they are talking. You need to develop that listening skill. Effective communication skills are essential for social workers to build relationships with their clients, establish trust, and facilitate meaningful conversations. They should be able to listen actively, empathize, and convey information in a clear and respectful manner. Social workers are not rude, so you must know how to relate with your clients respectfully. And again, you need to know how to empathize with them. We are not saying you should sympathize with them. Empathy simply means putting yourself in the shoe of another person. So that will help you to know why that person is behaving the way he or she is behaving. That's according to Max Weber, he talk about Verstehen, which also means the same thing as empathy. It also means the same thing as empathy. That you put for you to know why somebody who is homeless is behaving the way he's behaving, make yourself homeless first and see if you not behave in a worse situation. So that is empathy, putting yourself in the shoe of other people. So that will help you to relate with them well, and to attend to them in a better way and respectfully. That is talking about communication and engagement. Like I asked at the beginning, is it the same material you have with you or you have another one? Hello?
Sir, we have the material with us, sir.
Okay, the same material you have with you.
Yes, sir.
Okay, fine. I just want to know because it was Dr. Tere that sent it. Okay, fine. So the next one is cultural competence. As a social worker, cultural competence is very important. You must understand the culture in which you are practicing. You are not to judge other people based on your own culture. You are not expected to be ethnocentric. Put your values and your culture by the side and attend to your clients irrespective of their culture. So you need to understand the culture where you are. You need to understand, for example, Nigeria is multi-ethnicity group in Nigeria. There's nothing wrong if you can learn 2 or 3 more cultures outside your own. Even if it is just their greetings, somebody coming from maybe you are Yoruba and somebody coming from the eastern part of the country, and they enter your office, you give them in their own language, and that will help them to feel at home. Not that Igbo people, they don't have respect. Hausa people, they are this. Yoruba people, they are that. You need to just free your mind from such bias that you have. You understand? As long as that person has not behaved in such manner, believe that that person is perfect. You get it? So, cultural competence, social workers need to be culturally competent and sensitive to the diversity of their clients' background and experiences. Cultural competence involves understanding and respecting different cultural beliefs, values, and practices, and being able to work effectively with diverse populations. The next one is ethical practice. You need to know what is obtainable in your profession, the ethics, what you do and what not to do. Your limits, you need to know your boundaries. You get it? So, because it is the same ethic that be used to judge you if you go against the ethics of your profession. You get it? Social workers must have a solid understanding of ethical principles and values. They should be able to navigate ethical dilemmas, maintaining confidentiality, and adhere to professional codes of conduct. Although some people will tell you, and I strongly believe it is not in all cases, you maintain confidentiality. You get it? For example, we all, or some of us, we are aware of what happened during the time of Ebola in Nigeria. I believe we know what happened. Who can remind us the name of the man who brought Ebola into Nigeria? Who can remind us the name of the person who brought Ebola into Nigeria? Can anybody remind us? I'm not saying you should Google now, because I know that is what we are doing already. The name of the man who brought Ebola into Nigeria is Patrick Sawyer from Liberia. And the woman, the doctor who attended to her, sacrificed her life for the entire country. The woman happened to be the granddaughter of Abat Macaulay. You get it? The woman sacrificed her life for the whole Nigeria. In such case, you can't talk of confidentiality, because the life of that man is inimical or was inimical to the entire country. There are some cases that you have to blow up, because if you keep quiet, the impact, the negative impact will be so devastating. So you need to know when to maintain confidentiality. In some cases, you need to open up and let the Oh God, I don't like all this. Okay, let's continue. We are on case management and advocacy. Social workers often need to engage in case management activities, including coordinating services, collaborating with other professionals, and advocating for their clients' rights and needs. As a social worker, you have other agencies that you work with in collaboration with. For example, when you have a case of rape, it is not what you can handle alone as a social worker. You have to collaborate with the medical facilities. You have to collaborate with security officers. So you need to know how to manage, coordinate your relationship with other agencies, and also how to manage, cases. You need to know when you are to be at a particular point in time. If you are to appear in the court for your claims, you need to know. And again, you need to go through your files even after the day to know where you stop, to know what is next, to know where you are starting from the following day. Social workers often need to engage in case management activities, including coordinating services, collaborating with other professionals, and advocating for their clients' rights and needs. The next one is crisis intervention and trauma-informed practices. There are crises everywhere. then you need to know how to intervene. Social workers should be equipped with skills to respond effectively in crisis situations. There are different crises that you must know how to handle them. You must know where to start from, what to start with. You get it? Then again, even if it is trauma cases, you must know how to handle it. How to handle trauma with children, how to handle trauma with adults, it's not the same way. You get it? So social workers should be equipped with skills to respond effectively in crisis situations and provide trauma-informed care. Training in crisis intervention help them support individuals and communities during emergencies or traumatic events. Another one is reflective practice and self-care. Reflective practice simply means you looking at what you have done in the past, and this will help you so you don't have to start all over again. And this will also help you to keep you, update, because you have handled such case before. And again, it will also help you to see the pitfalls, the mistakes you made in order to avoid such mistake in subsequent cases. So this will help you in reflective practice. And again, self-care. Social workers need to take care of themselves because you have so many responsibilities, you have so many people. But as a social worker, you must know when to say no, that will continue tomorrow. Because the case is like you having a horse and you have a message. If that horse is dead, or if the horse dies, they will give the message to another horse to run with it. And the horse here we are talking about is you. So you need to know how to take care of yourself. Being a social worker can be emotionally and mentally demanding. Professionals need skills in reflective practice to regularly evaluate and learn from their experiences. They should also practice self-care to prevent burnout and enhance their own well-being, because you are alive. That's why people refer to you as a social worker. So the next one here, okay, before we continue, we said continuous learning and professional development are crucial in social work as new research interventions and practice models continually emerge. So you can't say as it was in the beginning, it's now forever be. No, you must continue to update yourself. By continuously expanding their knowledge and honing their skills, social workers can provide the highest quality service to their clients. So looking at characteristics and skills of successful social workers, we have empathy, communication, organization, critical thinking, active listening, self-care, cultural competence, patience, professional commitment, advocacy, objectivity, persistence, flexibility, resilience, and drive. These are just few of the characteristics and skills of successful social workers. So we look at them one after the other. Empathy. Empathy is the ability to identify with and understand another person's experience and point of view. According to National Association of Social Workers, it is defined as the act of perceiving, understanding, experiencing, and responding to emotional states and ideas of another person. When you understand, you know how to respond to them. You know how they feel. You get it. Stepping into someone else's shoe, that is just a layman's explanation of empathy. Stepping into someone else's shoes and recognizing that experiences, perceptions, and worldviews are unique to each individual's. This enables social workers to better understand and build stronger relationship with clients. Once you understand that Experiences, perception, and world views are unique with each individual. It will enable social workers to better understand and build stronger relationships with clients. It's a vital skill that helps social workers to determine a client's needs based on his or her unique experiences in order to efficiently provide services. This will help you to provide the needed services, for your clients. The next one is communication. Like we said all the time, it is divided into three. You receive, you process, and you respond or you give feedback. Communication, both verbal and non-verbal, is a vital skill for social workers. The ability to communicate clearly with a wide range of people is essential. It might require you getting an interpreter, for you to really understand your client. You might need somebody to interpret, and you can even ask your client to bring the interpreter. So it will look as if the person you brought did not give a real explanation of what the person is giving. So talking about communication, because your services depends on what you get from your client. The ability to understand your client will help you a great deal to provide quality service to that client. The ability to communicate clearly with a wide range of people is essential. It is the duty of social workers to advocate for their clients. In order to do this, social workers must understand the client's needs. In addition to being cognizant of body language and other nonverbal cues, this means communicating appropriately and effectively with clients regardless of cultural background, age, gender, literacy skill level, or disability, irrespective of the person's ability or disability, cultural background, or socioeconomic status. You are there for everybody. Social workers must also communicate with care providers, colleagues, and agencies, and must document and report information in a clear manner. Before I proceed, is there anyone we didn't understand? Is there anyone you did not understand? Please, I need your response.
So we
Is there anyone we
understood.
did not understand? So do look as if I'm just running. Hello, are we still together?
Yes, sir, we understand.
Yes, we
Okay,
understand.
fine. Okay, the next one is organization. Social workers have busy schedules and a wide range of responsibilities in addition to managing and supporting multiple clients, including documentation, reporting, billing, and collaboration. This requires social workers to be very organized and able to prioritize clients' needs in order to effectively manage cases. You must be well organized. Know where a day before you bring out the files for tomorrow, the appointment you have for the following day. You put them separately, who is coming first, who is coming next. That shows high level of professionalism. You get it? So organization is key. Very, very key. Disorganization and poor time management could cause a social worker to overlook a client's needs and result in negative outcomes. So it is very important that social workers are well organized. The next one is critical thinking. You don't just take everything hook, nice, and sinker. You need to also have that skills of critical thinking. When they tell you A, you don't just say A is A. You think about it, you look at it, how can this be? You get it? Critical thinking is the ability to analyze information gathered from unbiased observation and communication. Unbiased, like we said at the beginning, you need to leave out your value out of this. That you are a Christian and the person before you is a Muslim, leave it out of it. If you are in a country where homosexuality is practiced, leave your own out of it. You get it? If you get to a developed nation, US, UK, and you are practicing as a social worker and your client happen to be a gay, don't say, no, I can't attend to you. You will end up in jail. Because there was a time a priest was sent to jail because he refused to officiate maybe gay marriage or lesbian marriage. So because it is in the law, it is in their constitution, you don't deny them their right. But if you're in Nigeria, you need to know that you can't practice as a gay in Nigeria. You can't. You can't even come to say publicly that you are a gay in Nigeria. You get it. But anywhere you find yourself, you need to know what is obtainable in such environment, and you practice that too. I hope you are following. So you need to know what is obtainable, and you do that, and you don't deny other people what is their right. You don't deny them what is their right. I hope I'm making sense. You don't deny them what is their right as a social worker. So you need to know what is obtainable in such environment. So the next one is active listening. I've mentioned that before now. Active listening is key. Listening is a skill, and you just have to learn it. Listening is a skill. Active listening is necessary for social workers to understand and identify a client's need. Listening carefully, concentrating, asking the right questions, and utilizing techniques such as paraphrasing and summarizing also help social workers to engage and establish trust with clients. Even when your client is talking, you listen. Once in a while, you just interject. You mean that? Is that so? I think it's just to show that you are following, not that I say stop, let me. No. Just to let the person know that you are following. That is all you need. You allow the person to learn because that is what you are going to work with. That is your assessment period. So the next one is self-care. As a social worker, like we said earlier, you must take good care of yourself. You must take good care of yourself. You don't, kill yourself because of other people. What I mean is that you must know when to say no. You must know when to say, okay, we continue tomorrow. That is just the truth. You must know when to say, okay, we continue tomorrow. Social work can be demanding and emotionally stressful. So it is important to engage in activities that help you to maintain a healthy work-life balance. Self-care refers to practices that help to reduce stress and improve health and well-being. Engaging in these practices help to prevent burnout and compassion fatigue. Some of us, in the process of showing compassion, we are also killing ourselves. So we are talking about cultural competence, working effectively with clients from diverse backgrounds requires social workers to be respectful and responsive to cultural beliefs and practices. Don't impose your culture on other people's culture. You are not there as a pastor, you are there as a professional social worker. So do what is needed professionally. That is the point. That is the point. Social workers must be knowledgeable and respectful of their clients' cultural background and must, as stated by National Association of Social Work or social worker, examine their own cultural background and identify why seeking out the necessary knowledge, skills, and values that can enhance the delivery of services to people with varying cultural experiences associated with their race, ethnicity, gender, class, sexual orientation, religion, age, or disability. You know, like I said earlier, if it is in a country where gender orientation, different gender orientation is accepted, you work with it. You work with it. But in Nigeria, nobody can come to you and say, I'm a gay. Maybe it's about 12 or 15 years imprisonment. But when you find yourself in such place, you go ahead with it and do your work. That is what the Constitution says. Or you resign if you know you cannot, if it is against your belief and your religion. Possessing a non-judgmental attitude, that is talking about cultural competence. You need to have a non-judgmental attitude and an appreciation for diversity and the values of individual differences. Enable social workers to provide clients with what they need. So you must have that, know that. The next one is patience. You know, when you talk about patience, different clients, different cases require different timing. You may finish a particular case within a short period, and the other case might require longer time. Don't be in a hurry to finish that case because that might cause your clients a lot. And that can also place a question mark on your professionalism. So we are talking about patients. Social workers encounter an array of circumstances and individuals in their work. It is important to have patience to walk through complex cases and with clients who need longer period of time to make progress. This empowers social workers to understand the client situation and avoid hasty decision making and frustration that can lead to costly errors and poor outcomes for the client. So you need patience too. Don't be in a hurry. I must finish it. I must finish it. You may, have costly mistake. The next one is professional commitment. This talk about you developing yourself. This talk about what you are doing now. Professional commitment. You need to be committed to your profession. Do everything to earn your skills. Learn and relearn. You get it? Being successful in social work requires lifelong learning. Social workers must have a professional commitment to social work values and ethics and to continuously developing professional competence. This commitment is necessary for fulfilling the mission of social workers. And what is that mission? To enhance human well-being and help meet the basic human needs of all people, with particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty. The next one is advocacy, which is one of the key tools in social work. Advocacy. You advocate for, and you also advocate against. Yes, as a social worker, you advocate for and you advocate against. You advocate for things that should be put in place. You advocate against things that should be eradicated. So both are advocacy. Social workers promote social justice and empower clients and communities through advocacy. Advocacy skills enable social workers to represent and argue for their clients and to connect them with needed resources and opportunities, especially when clients are vulnerable or unable to advocate for themselves. The next one is objectivity. I've mentioned that before. You are meant to be objective, not to be subjective. You are to be objective. Put your values, your sentiment aside and see the way things should be seen professionally. You get it? So you are meant to be objective. Social workers witness the most vulnerable people in society, requiring desperate help. However, while remaining empathetic, it is crucial to stay impartial, remain professional, remain impartial. Don't allow people to push you to do something unethical. You must not be attached. Remain professional. It is crucial to stay impartial and make appropriate and informed decisions. The next one is persistence. Serving people in complicated relationships and environments requires patience and persistence. Setbacks are inevitable. The persistent social worker remains focused, set an example, and tries alternative approaches. You must not just give up after one step. You need to be persistent. That's why you need to know different intervention skills, different theories. If you use this one doesn't work, you use another one. You can use combination of one, of two or three methods or intervention. You understand? You have to be resilient. You must know, you need to be persistent rather. You need to know when to combine. You don't just give up. You can even involve your professionals, colleagues to handle some cases. Maybe they've handled such cases before. So you need to be persistent. You need to know when to change or try alternative approaches. The other one is flexibility. As a social worker, you must be flexible. You don't need to be rigid. You get it? For example, when you talk about the issue of closing time and resuming time, you don't say my resumption time is 4 and I close 8. My resumption time is 9 and I close 5. There are some times that the case at hand will require you coming earlier and require you to close late. So don't say, no, I can't do that. No 2 days are the same in social work. Problems are frequently unexpected and do not follow a typical 9 to 5 schedule. Solving difficult situations will often involve dealing with other agencies and supporting families in their needs outside your regular hours. So that talks about the flexibility, then resilience. To avoid burnout, social workers will need to learn coping mechanisms and know when to say no. Resilience helps to bounce back from challenging and emotionally draining days to face the next client tomorrow. So resilience is telling you, I need to go home now. We'll continue tomorrow. Not that you must finish everything that day at your own expense, detrimental to your own health. You get it? You must know how to balance job and family and life and health. You must know how to balance the two. Then the next one here is drive. Drive. Social work can be highly satisfying and rewarding. Helping people who need it the most requires individuals to learn new skills and be motivated to be their best. That is, as a social worker, you need to learn new skills. It gives you joy when you attend to people who could not help themselves, providing help to those who could not help themselves. It gives you joy to put smiles on those who smiles has disappeared from their faces. So as a social worker, you must always do upskilling. Don't just sit with what you knew many, many years ago. Things are changing. The profession is dynamic. It is not static. You get it? While maintaining self-care, a driven social worker commits to providing the best service to their clients. Then the next one is number 16, which is time management. While an essential quality, that is time management, it is also a teachable skill. You can learn it. You can teach others. Social workers typically have too little time in the day to complete their work. As a result, they must find ways to allocate the right amount of time to the task they face. Remember, what we are talking about, or the title of this course is Skills, Knowledge, Understanding, and Skills in Social Work. What we are talking about will help you to be the best you need to be. So the next one is interviewing, number 17. When we talk about interviewing, is how to get information from their client. And the way you ask your question will also determine the kind of responses or the information you are going to have. You get it? So you need to know how to ask questions when you are talking about interview. Interviewing is an essential skill in social work. Social workers can learn techniques to improve information gathering through the use of multiple question types that can be tailored and used across many situations. This including open questions, what we call open-ended questions. Open-ended questions allow your interviewee or your client to speak at length to express themselves. That's why we call it open-ended questions. And the question that needs open-ended answer are questions such as how and why. These are questions that allow your client to express themselves. You understand? How, why. Unlike the short form, which we call close-ended questions, the answers are provided ahead of time. For example, yes or no question, they are close-ended questions. You don't have any alternative apart from those two. So they are close-ended. Your interviewer is not giving you additional options. So they are called close-ended questions. While open-ended questions allow you to express yourself or allow your clients to express themselves. I think we are following. Is anyone with you understand? Hello? Is there anyone with you understand? My people, are we together?
Yes, sir.
Okay, fine. So we talk about open-ended questions or open questions can help the service users feel listening to. The next one is close-ended, like I said. It asks the answer already, even before you ask the questions. They are yes or no answer. The next one is indirect questions. It can be helpful to phrase questions as sentences, providing flexibility in the length or type of responses. When you ask indirect questions, you also allow your client to talk, to get their knowledge, their understanding of it. When the question is not asked directly, you get it. Another one is probing questions. When you ask questions to probe further, to unearth whatever your client has not said, you keep probing, because that is what you want to bring out from it. This helps to elicit more concrete answers or greater detail from your respondent or from your client. Then the last one there is hypothetical questions. Valuable for encouraging the client to think. With this, you should help your client to also think. These are hypothetical questions. To think positively about a possible future. No single question type should dominate. It is better to use a range of questions to encourage a natural conversation rather than an interrogation. When you combine all these question types, it will make you look as if you are having just a conversation with your client rather than interrogating him or her. So it will look as if it is an interrogation. By the time you combine all, it will make your client feel at home. You get it. Social work can be a demanding industry that requires working with people with diverse needs. Individuals in this field must develop a unique skill set to excel in workplace. Learning about these required skills can help you determine your social work ability and areas that need improvement. Employment in the field is growing fast. That's why I see different people from different educational background or career background now coming to do social work. If I should ask now, out of the 35 of you in this class, how many of you have first degree in social work or master in social work? You see some people coming from English, coming from education. Is it true? Is it true that all
Very
of you
true, sir.
are not social workers? I know you won't talk. You don't want me to call you out. So that is it, because opportunities are found in the profession. Is anybody saying anything there? Please speak out. I'm not hearing you. Hello? Hello? Okay, fine. So like we said, employment in the field is growing fast. The United States Bureau of Labor Statistics predicts jobs will grow by 9%, grow 9% by 2031, faster than the average for all occupations. Can you see? That's why I see people coming to do social work, because opportunities are bound for them, even if not in Nigeria yet, but opportunities are bound for them outside the shore of Nigeria. You get it? By 2031, the job will grow by 9%, faster than the average for all occupations. All occupations. About 74,700 openings for social workers are projected each year. 74,700. Can you imagine? Each year, on average, over the decade. Social work skills include soft skills, such as organization and communication, and technical skills directly related to the job, like client evaluation. Social workers develop these skills through education, training, and experience. They should continually practice and improve their skills to keep up with the job demand. On-the-job training is also there. You know, anything that is worth doing well is worth doing at all time. The more you do it, the more you get experience. Social work is a profession committed to helping individuals and communities work through challenges they encounter in everyday life. Social workers are employed in various settings to advocate for and improve lives. They may work with general populations or specialize in areas such as mental health, children, or veterans. Their roles can be very beneficial to others as well as for themselves. Social workers help individual families and communities access valuable resources. As a social worker, you need to know the resources available in your society. You need to know where to refer your clients to. You need to know where should be the first point of call when you have a case at hand. Social workers help individual families and community access valuable resources to improve their health and well-being. Depending on your social work specialty, you may have various responsibilities and work in different industries, such as education, healthcare, and government. Understanding more about this job can help you determine whether this career path is right for you. A social worker helps individuals and families improve their quality of life by ensuring access to basic needs and advocating for an individual's human rights. They promote social change and empower their clients. Social workers help the people they work with by analyzing the environment, relationships, systems, and policies that impact their lives. Common challenges that social workers guide their clients through include poverty, child abuse, unemployment. These are common challenges. Mental illness, drug addiction, and trauma. Social workers build relationships based on trust and compassion. It's because your client trusts you so much, and that's why they open up to you. So social workers build relationships based on trust and compassion. They identify the issues their clients are experiencing and implement solutions such as physical relocation, therapy, or employment assistance. At this point, I want us to know that there are 3 levels where social work is being practiced. We have the micro level, we have the meso level, then we have the macro level. What determines these 3 is the number of people you are attending to. That is what determines the micro level, the meso level, and the macro level. Dealing with an individual, dealing with family, that can be seen as micro level. And dealing with organizations or association of families, this can as well be seen as practicing at the meso level. You get it? Then you can as well practice at the macro level. Practicing at the macro level, this has to do with policy formulation. You can see it is progressive, relating with individuals, relating with a group, then dealing with issues that affect community as a whole. That is the micro, the meso, and the macro level. So here are 3 levels of social work you can pursue in career. You can work as a micro social worker, dealing with family, dealing with individuals. Micro social work involves working with individuals, couples, families, and other small groups to help resolve challenges with mental health and problematic behavior. These social workers can work in an agency where a physician may observe their counseling sections and prescribe medication for the client based on their situation and condition. Micro-social workers may also establish their own private practice. That is micro level. The next one is meso level. Are we together? Are you following? Is there anyone you want me to go back to?
Yes, sir.
You said what?
We are following, sir.
You understood everything? Okay, thank you. So the next one here is the meso level. Meso social work is done at the level. Meso social work is done at the group level. These social workers usually conduct group sections rather than individual counseling, like working with family groups. This level uses a mixed method model, which means they use their social with their community work, administrative and evaluation abilities. Usually, these individuals work on multiple projects simultaneously, requiring strong attention to detail and multitasking skill. Then the last level is the macro level. This is where social workers deal with situations in the society. Even when we are talking about issues that affect the whole world, it is still at the macro level. It is still at macro level. And when you are looking at your community, it is still at macro level. This is where we are looking at issue of policy formulation. We want to change policy, then that has to do with relating with policy makers, those who formulate policies. You get it? Please, I'm coming. I have a small issue here. Okay, looking at the macro level, when social workers have a career at the macro level, they are working with the community, government, or other large client system. Their focus is on community organization, administration, and policy management. Macro social work's main goal is to improve systemic challenges that impact large community and cultures. That is when you are working at the macro level. Then the next one is, what does a social worker do? What does a social worker do? Social workers assist people with a range of educational background. What does that mean? Irrespective of the client's background, irrespective of their educational qualification, irrespective of their socioeconomic status, you don't discriminate. You don't determine who you work with. So that's what we mean by social workers assist people with a range of educational backgrounds and socioeconomic statuses. They recognize how a client's background can affect their mental and emotional well-being and response to treatment method. Here's the way somebody with high socioeconomic status will handle matter. It will be different from how somebody with very low socioeconomic status will respond to a case. Because somebody with poor socioeconomic status will be thinking of what to even put in their mouth. Not to talk of going through section. Not to talk of referral. Are we together?
Yes, sir.
So they will not be thinking about that. So knowing fully well people's class, people's socioeconomic status can affect them and can affect how they respond, to treatment. Social workers understand the unique needs of lifestyle sector in their area and engage with their clients respectively. You get it? So, social workers' responsibilities. What time are we supposed to end this class? The class started 3 o'clock. Is it a 3 hours class or 2 hours? It started 3:30, I guess. So even if it is 3:30, we're supposed to stop by 5:30. So we still have time. So social workers' responsibilities. While their job duties can vary based on the employer, some social workers, they are working with children. You get it? They are working with children. Some are working with people with disabilities. Some are working with aged, working in old people's home. You get it? So while their job or their duties can vary based on their employer or where they work, their location and specialty, social workers typically have the following responsibilities. 1, meet with clients to assess their situation and needs. Assessment is number 1. Assessment, because that is what will inform your decision. Assessment is number 1. It is what will inform your decision. That is what will inform your decision. So you start with assessment. You meet your client to assess their situations and needs. That's your starting point. After you might have done your clerking, after you might have collected the needed information, the how will I put it now? The demographic information and other information you need to get about them. Then you assess them by listening to them to get the information from them. The next one is gather patient information to understand the best treatment or counseling plan. The first thing is to do assessment, that is getting the information. Now the number 2 is now gather the information to determine the assessment plan, so to determine the counseling or treatment plan. So without that first one, you can't do this number 2. You can't do the number 2. Then in you providing counseling or treatment plan, that talks about supporting clients experiencing challenges such as unemployment. That could be as a result of referral. That is the intervention you are now taking now. Based on number 1 assessment, now you've gathered information, then what do? What type of intervention are you going to use for your client? Is it to support the person who is experiencing challenges such as unemployment? Is it to refer them? So you need to know what to do based on number 1, number 2. Then number 4, if it is not what you can handle by yourself, then you refer. Refer clients to other specialists or resources for assistance. It must not end on your table. You are there as a middleman, as a social worker. It must not end on your table. But after referring, you still monitor. You still monitor. That is that. Then the next one is monitoring. Can you imagine? I've even jumped that. After referral, then you monitor clients' progress and maintain record or case files. You monitor. Even if you are the one that is still carrying out that intervention, you still do monitoring. Then after that, you talk of advocate for their clients to promote awareness of community needs. You advocate for them that this should be put in place. This should be done. That's advocacy. Then the next one is work with lawmakers, organizations to develop or implement social programs or community resources for social change. This is at the macro level. Then we look at social worker skills. We've talked about them before now. We just list them. The skills, we talk about cultural competence, knowledge of mental health issues and cognitive development. As a social worker, even if you go to universities to study medicine, as a generalist, you need to have knowledge of every sickness, every disease. Is it true? At your first medicine, as in before you specialize, before you go for what we call asthmatic, before we talk of going for residency, that is area of specialization. Once you do your first 7 years, you have idea of all areas of human health. And that is the same thing with social work. At your generalist level, you have knowledge of everything. So one of the skills we talk about here, cultural competence, knowledge of mental health issues and cognitive development, social skills, counseling and coaching abilities, active listening, critical thinking, problem solving, then communication and interpersonal skills. Type of social workers. Type of social workers. type of social workers. If you are interested in a career in social work, there are a variety of concentrations from which you can choose. While social work provides support and resources for various groups and individuals, their focus and expertise can vary. Like we have mentioned, different areas. Understanding the different topics within this field can help you determine which one to pursue. Once you have understanding of all this as a generalist, in your master, you can decide which area you want to specialize. Social workers often focus on specific areas of needs for clients and communities. Some common types of social work include, we have clinical. Is there anybody who is a clinical social worker in this class? Anybody? Anyone?
So this is like a BSc. They just finished their BSc.
Is that what? PR, I didn't hear you.
So can you hear me?
Now, yeah. What did you say?
I said they just finished their BSc.
Okay, no wahala.
Yes, sir.
Okay, they are still generalists.
Yes, sir, they are.
Okay, no problem. Okay, we have clinical social workers. Clinical social workers can provide counseling treatment to clients with substance addiction, mental illness, and cognitive disabilities. They perform assessment, diagnosis, and treatment while recommending prevention suggestions to their clients. A clinical social worker can work one-on-one with a group or with families to provide support. They can also work in various settings such as private practices, hospitals, and mental health facilities. You may want to ask by the time we get to medical social work, to ask you what is the difference between clinical social work and medical social work. The major area for clinical social work are mental health facilities, issues that have to do with mental health. That's why you see clinical social workers. So after that, we have child, family, and school social worker. These are people that balance the relationship between the school, the children, and the family and their communities. If there's any problem with the students or with the child, they try to find out, is the problem coming from the school? Is the problem coming from the family? Is the problem coming from the community? And they have the right to take the child from the parent and put the child in a foster home. That is talking about child, family, and social work. Children and their families experiencing social or psychological challenges in school, at home, or in their communities may seek the help of a specialized social worker. This type of social worker protects children by assessing the suitability of educational, home, or neighborhood environment for the child and their guardians. They work with families and school staff to resolve issues and focus on child welfare or protection. Child and family social workers place children in foster care when necessary, monitor their well-being, and assist adults with adopting or becoming foster parents. That is why in Nigeria we've not gotten it right. Issue of adoption should not be done without a social worker, professional social worker. Do they help adults with adopting or becoming foster parents? They can work for schools, government entities, and foster care agency. Then we look at medical and public health social worker. We know that the issue of public health is prevention. So medical social worker, public health social worker, they work more on prevention, preventing the spread of a disease or spread of any outbreak. Individuals with health conditions or chronic illnesses can work with a medical social worker. They are not limited to mental health. They work with anything that has to do with health. You get it? Because we know we have Center for issue with health, like neuropsychiatric hospitals. That's where you see more of clinical social worker. But medical social worker can work in other hospitals. You get it? Not necessarily has to do with mental health. So the social workers assist by providing coping mechanisms, counseling, and medical referrals to the patients and their family. They also help patients seek public resources, that is referral, and coordinate healthcare services. They can also refer the family of their clients to where they can get help, for their families, maybe payment of their bills. It is not that social worker has to do that to pay bills, but they can refer their clients to where they can get such help, because there are some foundations in the hospital that are there where people are getting money to help. You get it? To pay such bills. A public health social worker may also strive to limit the spread of diseases and help communities overcome widespread illnesses and disasters. Medical social workers work for hospitals, government agencies, and healthcare providers. Do we understand? Hello? Can I proceed?
Yes, sir.
Okay, fine. The next one is mental health and substance abuse. This is related to the clinical social worker. These social workers coordinate and provide therapy, rehabilitation, and counseling to patients with addiction or mental health challenges. They provide rehabilitation. They can also refer patients for affordable rehabilitation center or rehab center. They help patients find affordable rehab centers and counseling programs based on their challenges. Mental health and substance abuse social workers also handle outreach and preventive programs to locate individuals in need and provide timely care. Mental health and substance abuse social workers may work for hospitals, residential treatment facilities, communities, organizations, and government agencies. Then the next one is community. The next one is community, sorry. Where am I now? The next one is community social worker. A community social worker provides resources and improves the social justice environment of a particular neighborhood, town, or city. Rather than interacting with individual clients, they work with a large group of community members. Community social workers focus on organizing and developing social programs to improve the quality of life in their area. Often, they work for local government agencies. The next one there is military social workers. Military service members and their families face unique challenges before, during, and after their military service. and can seek the assistance of military social workers who understand their needs. These social workers assess the well-being of well-being of service members, identify post-traumatic stress disorder (PTSD), and recommend treatment plans. They also help families cope with their relatives' deployment or injuries from serving. Military social workers commonly work for the government, but they can also work in private sector for health centers that frequently serve military members. Now I want to look at requirement for becoming social worker. Requirement for becoming social worker. Social workers complete specialized education and training to enter the field. Here are some requirements. I said the next one we are looking at is requirement for becoming a social worker. Social workers complete specialized education and training to enter the field. Here are some requirements to become a social worker. One, education. You can't claim that you're a social worker without education, although there are different levels. There are some that are referred to as auxiliary social workers. These are OND downward. From OND to school start, you can only be referred to as auxiliary social worker. Most social workers earn a Bachelor of Social Work at a minimum. A bachelor's degree in social work typically takes 4 years to complete. During an undergraduate social work program, you take courses in various areas, including human behavior, social welfare policy, research methods, case management, and ethics. Most bachelor's degree programs require completing an internship or field work to graduate. These are where you can get practical knowledge apart from the theory that you did in school. That's why social work don't joke with practicum. Practicum, you do practicum in year 1, year 2, year 3, even in your 400 level, but different number of hours is what is required. So that is that. So where you can acquire this practical knowledge. Most social workers degree program require completing an internship or field work to graduate. While you can find entry-level job with a bachelor's degree, many social workers earn a Master of Social Work MSW degree from a program accredited by the Council of Social Work Education. That is, but in Nigeria, we have what we call C-ISOWN, Chartered Institute of Social Work Practitioners of Nigeria. That is the institute saddled with the responsibilities of moderating the program, the profession. While NASO is an association. You get it? So you need to get your masters from accredited institutions. In some states, earning your MSW degree is a requirement to become licensed. In some states of America, for you to have your BSc, that is just a generalist. You cannot be given license. Cannot be a licensed social worker. But now, the institute is still giving license to first degree holder who have gone through this training that you are going through. And after that, you will be inducted, you'll be given your membership certificate as an associate social worker. That is where you start from as a graduate associate. Then after 3 years of attending conferences, both at the national level and at the state level, with evidences of payment of your annual dues, both at the state level and the national level, then you can apply for upgrade to become a member. That is, full member is another level. You get it? You can be a member, then you also have what we call full member. After being a full member, then you talk of your fellow, a fellow of the institute. So that is just that as you continue, you know better with the institute. So like we said, in some states, MSW degree is a requirement to become licensed, and having this master degree can also help you expand your job search because you will know your area of specialization. A graduate program typically takes 2 years to complete. In Nigeria, I think it's a matter of 3 semesters. 2 years to complete and involve a combination of coursework and supervised field training. Other degrees for social work include DSW, Doctorate in Social Work. It is a degree. It is also a doctorate degree. Most people who are on the field, who are practicing, go for DSW, while people in academics go for PhD. There's nothing wrong if you have the two. They are both doctorate degrees. If you have DSW, you are a doctor. If you have PhD, you are a doctor. And it is a 3 years program, even in abroad. DSW is a 3 years program, minimum of 3 years. And PhD too is a minimum of 3 years. So you can see they are more or less equivalent to the same thing. 3 years program. You get it. So you have doctorate degree after your first degree, BSW or BSc social work. Then you obtain your MSW or MSc social work. Then you can have your DSW, Doctor of Social Work, or PhD Social Work. Anyone you desire or you choose. Then after that, after education is training. This is the practical aspect of it. Like I was telling the class I just finished now, that I was asking, I gave my CV to a friend of mine after I finished my master's. He was already working with his first degree. And the next thing he told me was that, boy, guy, your CV is still a virgin. What do you mean? He said, you don't have any experience. You've not worked anywhere. You are just accumulating degrees. So what matters most organizations are looking for people who have experience. And that is where training comes in. Many employers prefer to hire workers with work experience. After graduating with a social work degree, you can complete training such as internships or supervised clinical experience. During this training, you may work under the supervision of a licensed or experienced social worker. You can use this training to apply your classroom knowledge in a practical environment and develop valuable skills to prepare you for a career in social work. Talking about you being licensed, I think I've talked about that. License requirements for social workers vary state by state. That is talking about United States of America, where different states have different requirements for you to obtain your license. But in Nigeria, it is still being run by only C-ISOWN, Chartered Institute of Social Work Practitioners of Nigeria, that the one starting with that responsibility of giving or issuing license to qualified professional social worker. So check with your state to determine the education, training, and examination requirement for licensure. To earn a license, you typically take an exam which may evaluate your knowledge of ethics, theories, and regulations. Most states require you to complete continuing education or training to maintain your social work license. After you might have been given your license, it is expected of you to still continue, practicing, to still continue, attending international social work. Don't just say you have been given license, then you keep the license. The license is not forever. One, if you have any ethical issue, your license can be withdrawn. And after 3 years, if you have not done anything with the institute, either at the state and national level, your license will not be renewed. Your license will not be renewed because your license is meant to be renewed every three years. For now, it is three years. I don't know what will happen, but for now, it is three years. So your license can be withdrawn, and you might be denied renewal of your license. So it's not that I've collected license, I have license, so you just go and sleep. I hope that is understood. Then we look at different types of social work specialization. Type of social work specialization. Type of social work specialization. Pursuing social work specialization may benefit you by helping you qualify for particular professional roles and by developing your expertise regarding a specific population or topic. For example, I am an industrial social worker. There are some who are clinical social worker. There are some who are medical social worker. There are some who take care of aged. You get it. You have different areas of specialization, but it's left to you to choose where you want to belong. You get it? It's left to you. Like we said, you are generalists now, but you must have touched different areas. You must have taught different areas during your undergraduate program. So this will determine which area do you want to focus on, which area do you want to specialize. So that will determine, what will be your area of specialization. Pursuing a social work specialization will benefit you, helping you qualify for particular professional roles. For example, I said I'm an industrial social worker. So if they need an industrial social worker, you as a medical social worker will not go there and apply. Where they need a medical social worker, I as an industrial social worker will not go there to apply. So it's streamline, what you can do, an area where you can work conveniently and, use your professional expertise. That is it. That will help you to know where you can focus. That is when you have your area of specialization. This can help you serve your community by providing you with in-depth knowledge and experience in handling a particular aspect of social work. You can't just say you are a jack of all trades, master of none. You have an area of specialization. You get it? You have an area of specialization. So this will help you to serve your community well with your expertise in handling a particular aspect of social work and encouraging you to develop skills relevant to your concentration. Employers may prefer candidates with a background in a specific aspect of this field. To focus on a single group or topic may improve your prospects of becoming employed. You become a specialist in that field. You become an authority in that area. You get it? That is the area, that is the reason of specialization. If you are interested in pursuing a career as a social worker, There are a variety of specialization you can choose from, including we have public welfare. Public welfare. Specialization in public welfare social work may involve facilitating income and financial support for individuals who require assistance. They may work with older adults, children, and people with disabilities or chronic medical conditions that prevent them from obtaining or keeping a full-time profession. Social workers with this concentration, that is public welfare, may provide support and resources directly or take on the role of manager, administrator, or evaluator for public welfare service program. Some of their professional duties may include: 1, evaluating the criteria and standard for service delivery, training new staff members and supervising employees, administering financial programs, because in such case you are handling public fund too. So you must know the conditions of giving such fund or giving such assistance. You get it? You evaluate the criteria and standard for service delivery. So that is when you are a public welfare social worker. Then the next one is school social work. If you specialize in school social work, you may help support children with their emotional, behavioral, and social challenges and act as a point of connection between them, their family members, and community services. In addition to public and private schools, you may also find employment with a social services agency or residential treatment center. Your primary responsibilities may include assisting students to overcome issues that interfere with their learning and overall well-being. If you are a school social worker, you may help students with various concerns, including teen pregnancy, food insufficiency and homelessness, truancy, and school dropout. Another area of specialization is research. If you are interested in pursuing an academic career path as a social worker like myself, you may consider engaging in social work research after you earn a relevant postgraduate degree. In this role, you may collect data about social work methods, interactions, and strategies, and use research-based knowledge to predict the effectiveness of various social work approaches. You may support the existing facts or from your study and your conclusion, you may refute what is existing. That means you have identified a lacuna in an existing knowledge. So you are adding to that, and that is through your research, because you saw a lacuna, and with your study, with your research, you have filled out that lacuna. You can use the data you collected to determine whether specific programs are making sustainable and positive social change, and make recommendations about ways to modify and improve them. As a social work research professional, you may find employment with various organizations, including government agencies, universities and colleges, research institutions, or research foundations. Another one is healthcare. Social workers who specialize in healthcare assist people as they handle the social and individual factors that contribute to their health and well-being. These professionals may work one-on-one with individuals, groups, and families to care for and support their mental and physical health requirements. Alternatively, they can also focus on planning, policy development, and administration of specialized health care, social work procedures, and programs. Healthcare social workers can perform a variety of professional duties, such as developing innovative research-based programs, providing social work services to community members, gathering data, and conducting research. The next one there is community organization and advocacy. Community organization and advocacy. Because they interact with and care for a variety of populations with varying levels of access to resources, social workers may specialize in advocacy with the goal of improving the rights of individuals and groups within their community. This role can include collaboration with affluent organizations, international organizations, and so on. That's what we are affluent organizations and professionals to assist individuals who require emotional care, financial assistance, and medical support. To challenge inequality, social workers who specialize in community organization and advocacy may defend the rights of their clients, argue on behalf of a particular group or people or person in order to increase their access to resources and services. They also assist individuals as they handle the policies that are currently in place. They talk about developmental disabilities. Some social workers specialize in developmental disabilities and help parents of children with developmental disabilities know their legal rights and the rights of their children, like the issue of albino. They are not meant to be discriminated against because there's a policy that is being put in place. You as a social worker can help, fight for the right of such child. Even now, the disabilities, the people living with disabilities are everywhere working with the government. Some years ago, I was in a ministry for gender affairs in the state where I'm working, and I was shocked when I saw a man who is having sight impaired. This man was with his cane, that cane they used to walk. And I was told that man was an assistant director. I was so much touched. And I've seen somebody too who is on a wheelchair, who is working with University of Ibadan. I've seen a person working with University Teaching Hospital Ibadan, UCH. The man on his wheelchair and with his laptop on his laps, move around with his wheelchair, automatic wheelchair. He move around by himself. You get it? So you help these people to advocate for their rights. They don't just discriminate against them, so they can enjoy what other people are enjoying in the society. Are we together? Are we together?
Yes,
Social concentration can create self-care methods and techniques to assist parents. Because some of the parents don't even know where to go to get assistance, to get help. So social workers in such field can provide assistance to such parents, to fight for the rights of their children and to also, assist them in terms of resources to refer them. Encourage parents to reach out to extended family members to provide them with additional caretaking assistance. Then we have some social workers who are with aging and elderly care. Aging and elderly care. Professionals in this field whose concentration is aging and elderly care provide older individuals with resources and services that may allow them to live as independently as possible and participate in their community. This can help older people live with dignity and may improve their quality of life. Social workers who specialize in aging may also protect elderly individuals from harm and injury. They may focus on a variety of older people's lives, including social interaction and involvement within their community, economic and financial planning, mental and physical health, and well-being. The next one is criminal justice social work. Social workers who specialize in criminal justice can play an important role in the legal system and correction processes and provide support for people accused of crimes and incarcerated individuals. Incarcerated means people in the prison. They can, help. They can help. They can provide help, assistance to such people. Are we together? They can provide help to such people. They can provide help to such people. They may also act as victims advocates and provide services and care for individuals affected. For individuals affected by the incarceration of their family. Some people, as a result of the incarceration of their family, being imprisoned. Maybe the person that is in prison is the breadwinner of the family. Definitely, it will affect many people in that family. So, social workers in that area, criminal justice social work, can also help the family members of those who have been incarcerated. Individuals may pursue this specialization if they're interested in a career. If they're interested in a career in law enforcement, but have no desire to police their community or practice law. Common roles for these professionals can include criminal justice and probation social worker, juvenile probation counselor, forensic social worker. Then the other one here is clinical social work. Clinical social workers provide members of their community with mental health services. Remember I said it at the other time that these people in clinical social work, they focus majorly on mental health. They work in mental health facilities. They provide mental health counseling to the people in their community. These professionals provide direct care for individuals, groups, and families, and may be the only access that community members have to mental health services if they live and work in a rural area. That means you can have a community with just one social worker in this field. That means such social worker will be saddled with so much responsibility. Will be saddled with so much responsibility covering the entire community. They typically work in private practices, either alone or with other mental health professionals, and assist clients who may handle a variety of disorders, including depression, anxiety, and domestic or relationship challenges. Clinical social workers may qualify for several roles such as behavioral health counselor, mental health social worker, licensed clinical social worker. Then the next one we are looking at is international social worker. International social worker. If you specialize in international social work, you may provide services and resources for refugees, immigrants, and international health and community organizations. You may work with groups of or individuals and assist them as they navigate membership of new communities. No refugee, those people who are in another country, maybe as a result of challenges or problems happening in their country. So they be in what we call refugee camp. So we can see an international social workers working in that organization. You may work with groups or individuals and assist them as they navigate membership of new communities, learn new languages, and adjust to their surroundings. One of your primary goals is to help people gain and maintain independence and become self-sufficient to improve their quality of life. You may focus on community building by providing others with religious, social, and institutional connection. You connect them to the church, to the religion of their choice. Maybe they are new in that community. It is also the role of international social workers to do that. Social and institutional connections. With this specialization, you may be qualified for the following position: immigration social worker, equality and social justice social worker, community outreach social worker. The next one we are looking at is policy planning. Policy planning. Social workers who concentrate on policy and planning may influence the improvement or solution of a specific social issue and may use their position to influence others regarding this social change. They may highlight serious issues that impact many people within their state or the nation, including racism, homelessness, poverty, and violence, because these people are working to amend policies that are not favorable. So they work with policymakers and decision makers to create sustainable and substantial change. They may collaborate with lawmakers, policymakers, and members of the media. These professionals can have various responsibilities and tasks, including recognizing social issues that impact others, conducting research and studying individuals' requirements, creating legislations proposal. Then the next one here is administration and management. Administration and management. Oh my God. I want to see where we can stop. Okay, we stop on benefits of becoming a social worker. Okay, the next one here is administration and management. If you specialize in social work, administration, and management, you may hold a managerial position for a social work institution or other organization that supports and empowers employees. If you work for a corporation, it may be your responsibility to ensure that the business acts according to its values and missions and provide adequate compensation and benefits to its staff. You can work in both private and public professional environments and assist individuals or groups in healthcare clinics, hospitals, and community-based agencies. As a social worker with a specialization in administration and management, you may qualify for the position of program director, social service manager, director of social services. Then the next one is occupational and employee assistance social work, EAP. That is what we call employee assistance program. Employee assistance program, that is EAP. So we talk about occupation occupational and employee assistant social work. Specializing in occupational and employee assistant social work may involve assisting an organization as it alters its operation structure and strategies to increase productivity or improve employee creativity and satisfaction. With this social work concentration, you may provide services for a company's employees who have social, health, and family issues. You can also support and counsel members of an organization union and manage the mental health services for a company. You may be responsible for providing services related to single parenting, substance use, and vocational rehabilitation challenges. Consider pursuing the following role: Employee Assistant Program, EAP, EAP Managerial Consultant, EAP Licensed Clinical Social Worker, EAP Counselor. Then we talk about mental health and substance abuse. I think that's where we are stopping. That's where we are stopping. So we leave it at tip. Coming. So we are stopping there. Mental health and substance abuse. Social workers who specialize in mental health and substance abuse provide assistance and resources for individuals to help them recover from substance abuse. These aspects of social work also include the involvement of a client's family and other members of their community to address substance abuse and addiction. Because if you are working on somebody who abuse substance, you need the assistance of the family and the community to also monitor the person. Because while you are not there, the person is with the family members. This means that they may address cultural norms and attitudes, support system within their neighborhood or family or and local policy to assist groups struggling with this behavior. If they are working with the community, they can tell the community to put in place a law that anyone that is found smoking or taking any drug in the community will face XYZ. That can also limit substance abuse in the society. So that's why they need to work with the community, work with the families in order to achieve their goal. Social workers who concentrate on treating tobacco, alcohol, and drug addiction may handle the following responsibilities: advocating for housing and employment opportunities, providing individuals and group therapy, focusing on community resource development. I would like to stop here. I don't know if anybody has any question to ask, but that's where we are stopping. I think we've been here for 2.5 hours. There's no way we can cover everything in a single day. That's about 48 or how many slides you have there? Is it up to 48 or 40? And which number are we, sir? Which number are we on your page, please? I'm using tablet, so it's not showing numbers. Hello? Are we together?
Yes, sir.
So on what page did we stop? Page what? Where did we stop? Then anybody checking that for us?
Page 13,
I think
sir.
we are
13.
13.
Okay, 14. I think we cover some ground in a single class. I don't know if there is opportunity to have another class after now, but at least can do another one. I think that will take us to maybe 26. In fact, there is an aspect we are not going to touch because we've said it, we've touched it before now. It's just repetition on this page. Issue of essential skill and traits of social workers, empathy and the likes. We may just jump that and move to theory. So maybe when next we meet, if possible, we may be able to finish that the next class, if possible. So thank you very much for your rapt attention. Bye.
Thank you, sir.
Yeah,
Thank you, sir.
welcome.
Thank you, sir.
You're welcome.